Hello and welcome to my YouTube channel. This is Dr. Ash from London. I hope you guys are having a very good day today. Today I'm going to talk about MRCEM, Member Royal College of Emergency Medicine exam. Its worth in UK, Middle East and other Gulf countries, and comparison between MRCEM, MRCS and MRCP. So let's talk about first whether this MRCEM, Member Royal College of Emergency Medicine exam, is it worth or not? So, because I know in Pakistan, India, and other third world countries, still people believe that uh, the super specialization it is the way forward, and still people think that neurosurgery, general surgery, and people think about all those fancy things, cyber knife, laser light. But I would still say that if you ask me the worth of any exam, the highest one at the moment, I would say it is MRCEM, MRCEM, which is a Member Royal College of Emergency Medicine. Why I would say it is really worthful, because this exam will give you a job in United Kingdom straight away. And I believe as a doctor, I put myself when I was a fresh graduate, I really wanted to learn things from UK. It really doesn't matter what level, what post, what is it, training, non-training. I just wanted to see how the system works in UK. Once you are here, then you can actually do a lot. So MRCEM, as soon as you pass this exam, complete part 1, 2, and the OSCE, the UK hospitals will take you straight away. You don't need to come to UK for apply for the job. The job will come to you. The agencies will contact you. You will get an interview on the phone. You will get the sponsor visa. And the most important thing is, even if you don't have an IELTS or OET, and if you haven't attempted IELTS and OET in last 2 years, you can get an exemption from that. I remember in 2017, we did interview few doctors from Egypt and Pakistan who didn't had IELTS and OET, but on the basis of their interview, on the basis of their performance, we got them an exemption from the English exam, and now they are both working in London. So look at the scope. If you spend 2 years after your graduation, after your house job, properly in a hospital, and if you do this exam, you can actually move any part of the world. This is the worth in UK. Now, once you move to UK, what you can do with the MRCAP, you can take a specialist post, you can join with a senior registrar job, and your starting salary would be around 70,000, which is a really big number in terms of joining as a pleb SHO. So this is another point. Second point is that with the MRCEM, once you have done that, if you do 6 months in UK as a non-training job, or maybe 1 year, you can do some paperwork, and then you can apply for ST4 training post. And I, as a being interview panelist for Health and Education England, we do see a lot of Indian doctors. They come to UK after passing MRCAP. So you can do MRChem in your home country, and you can come to UK, spend maybe half an 6 months or 1 year, and then you can apply for ST4 training post, and then after 3 years you can be a consultant. So it's a really very good shortcut, worth it. Now, I already said that emergency medicine, if you see my previous video, specialty itself, I already spoke about it, how worth it is. So watch that video. Now, coming back to the MRChem, what is it worth in Middle East and Gulf countries and Saudi Arabia? Again, it is in a huge demand. Like in UK, we are struggling with for emergency doctor. We don't have enough senior emergency doctor. 3, 4 hospital I worked recently as a consultant. The lead and medical directors are saying that for last 6, 7 years we are unable to recruit our full middle grades or the registrars. We are unable to recruit for 7 years, and they keep saying me, if you have any MR camp positive doctor, just give it to us. So you will be taken open-handedly, which is a really good thing. Now, in Middle East, Dubai, UAE, again, all these countries, they will take you straight away. If you have MR camp, you will get a job. They have a specialist title. They recognize this degree as a specialist degree. If you have 4 years, 5 years of experience in ED, then you can take a specialist role in Oman, in Dubai, in UAE, in Muscat, all these countries. So now this is the acceptability of this degree. Now, coming back to comparison with the MRCP and MRCS, let me tell you that all degrees have their own worth. If you want to be a surgeon, no matter how much sweet, I present MRChem to you, you will never do it. If you want to be a surgeon, you will do MRCS, isn't it? I'm just comparing which is easier and which is difficult. MRCS is one of the easiest kind of membership exam compared to MRCP and MRChem and MRCPCH. The easiest why I say is because it is not an exit exam and you have to reappear in FRCS anyway. So they know that it is an SHO level exam. Once you are CT1, 2, you have to do MRCS to get into S2, ST3 and further. So that's why the passing rate in MRCS is significantly higher compared to other. Comparing MRCP and MRChem, it is really difficult job. I've done both MRCM and MRCP both. I would say MRChem is difficult because it has a wide curriculum. Exam itself is stressful in a way that there are 18 stations in MRChem OSCE and MRCP. There are 5 stations. And MRCP, we know the curriculum for years. It's been there for centuries. There's a lot of material available, a lot of teaching stuff, a lot of supervisors, FRCPs, MRCPs are spread everywhere. So they can guide, they can teach. So I would compare MRCP a little bit easier in terms of availability of the resources and kind of preparation and, uh, the kind of set pattern there for centuries. So people know what is to be expected. But in MRChem, as I said, that this is a wide curriculum, and you can have neonatal resuscitation to adult resuscitation to trauma, and there's a huge variety, which is really something which makes this exam special. This is the reason why it is so much worth everywhere in the world. So I compared MRCS with MRCP and MRChem. I said with the MRChem you can easily move to UK. With the MRChem you don't really need to have an IELTS in your pocket. You can negotiate with the trust. You can get a better salary. You can apply for ST4 training post. You can join a training program. You can do an FRChem later on while you are in UK. So it can open a huge potential for you. And the most important thing I would say that MRCEM, uh, unlike the fellowships in the home country, like in Pakistan, Bangladesh, and India, you don't have to be in a training post. You can actually do this exam while on any non-training post as an MO, RMO, CMO, clinical fellow. You can locum. You can do this exam on any post. All you need is a good hospital. Doesn't need to be a tertiary care or doesn't need to be a teaching hospital. It can be a good hospital. It can be a private hospital like in India. Apollo Hospital is doing that. It can be a district level hospital in Pakistan. All you need is a good supervisor, immediate boss, FRCS, FRCP, or someone who can actually understand the system in UK, and they can sign your paper off, and then you can appear in exam. Regarding the components of MRChem, it has part A, part B, and part C. It used to be like that. Now they have changed it to part A has been changed to FRChem primary, part B is now known as FRChem intermediate, and the MRChem OSCE is still the same. We have an experience of teaching MRChem for last 8 years in UK. We have trained and taught more than 600 doctors for MRChem in United Kingdom, and we proudly say that most UK hospital in emergency department you will find our doctors who were actually went through our course. So if you pass your primary FRChem primary and intermediate the theory exam, we can help you with the clinical exam. We can help you with the OSCEs, and we can put you to that ladder. I hope this video was useful. Thank you very much for watching this video. You can subscribe my YouTube channel for more such content, and please leave your feedback. If you have any question, ask me in the comment and I will reply. Thank you very much, Dr. Ash.